Good morning. Nice day here. Out with the dog as usual. This seems like a good opportunity. Where is my dog? Charlie! Oh, there he is. Lovely Charlie boy. Anyway, I've been struggling. So I've got a highly oversensitised nervous system at the moment, which is massively contributing to my nerve pain, but there is a mechanical source of this. I've got a bulging disc in my neck, which is compressing my C6, C7 nerve root on my right side, and this has caused me absolute agony in the form of pain attacks, acute pain attacks. So the pain isn't there all the time, it kind of comes in waves, and then for about an hour or so I'm in agony and I can't do anything. It's horrible. I have to stay calm, throw a blanket over my head. It is gradually getting better now, thankfully, but you'd expect someone to recover from this sort of issue because it's not a herniated disc, it's just a bulging disc. You'd expect someone to recover in a few months, really, maximum 3 months, and this is now month number 10, and this is because I have MS. So MS is affecting my recovery. It's making my nervous system more reactive, making me more vulnerable to pain, so it's more painful than it might be in somebody without MS. I was going to talk about another subject as well. I'm going to have to do a separate video. Just wanted to kind of tell you about what my situation is currently. I'm also iron deficient, which is a systemic factor that can contribute massively. Again, my nervous system can't recover without adequate iron, so I would urge anyone or everyone to make sure they have a blood test and have not only the things you would normally look for with MS, but all other contributing factors, your iron, B12, all this sort of thing. You could ask ChatGPT, ask AI. There are other AI generators available. You could ask what things might contribute, but a blood test is massively important, and also for you to not wait for your doctor to pick up on the results, because you may not actually cause a red flag to be raised unless you're off the limits of the blood test levels. This varies according to which area you live in the UK, but also you might have a combined number of factors or just one, that it may not be raising a red flag with your GP, but it may still be too low or too high, and that could be contributing to a symptom flare-up. So again, I've found it really useful to use AI and drop screenshots of my blood test results. You need to do that quite soon after they come out. I use the NHS app where they are published. You can drop screenshots and it will interpret them for you. It's not to say that AI is better than a doctor, but it will kind of consider different factors, and it gives you that holistic approach that may be lacking. Well, it's certainly been lacking for me from my GP and my MS team. I've made complaints against both for this reason, because I've been iron deficient for a long time, but it got a lot worse since my last relapse, and it's really, I've noticed huge impact on my symptoms. So you've got to be proactive, I'd say. Otherwise you could be dealing with things that are really impacting your quality of life for a long time.